Okay, I'd like to call the April 7th, 2022 Health Committee meeting to order. We have all members but Member Bloomfield present, and I know Member Chung has to be gone by 6, so we'll try and get through this pretty quickly. We have minutes to approve from the March 3rd, 2022 regular meeting. Do I have a motion? Motion by Chung, second by Metzger. Any additions or corrections? All in favor?
Aye.
Any opposed? Okay, minutes are approved. Do we have any members of the public? Thank you. On to Departmental Matters. First up is Jessica McKnight, Health Department Administrator.
Hello.
Hello. You don't have any items for action?
No items for action, but my report you have, and if you have any questions, I will definitely try to answer them.
Does anybody have any questions on 4A2A on her monthly report? Member Chung.
Thank you. So I guess my question is, it's my understanding that the Redditus testing site closed last week.
Mhm.
And then I've read in your report, I guess, just want to get it on the record, I guess, what the options are now. Because I know cases are low here, but it's good to have those options open in case people need to get tested.
Yes, so
you.
definitely options are still available in McLean County, including the health department operating 3 days a week at Grossinger Motors right now, at least through the end of April. So at the time of the report, it was the first 2 weeks, and we've decided just based on what the pickup the last couple of days that we will extend through April. But also on our website, we do list a couple other locations and try to keep those updated. But I think it's coronavirus.gov is the new website the feds have launched. So any COVID information you need, you can find testing and vaccines there.
Other questions for Ms. McKnight on her monthly report? Okay, 4A2B is a resolution, it's just an information item on a resolution amending the FTE position for the health department, and that's in your packet, and it probably was approved yesterday at finance. So it's just an item for information. Any questions on that? Okay.
Yeah, I just wanted to compliment her on they're adding it, but because they have this, they have some funding, but she's utilizing interns. So I think that's a wise choice, and it provides us an opportunity to have some young people in the office, not that we don't, but just have new people coming in, and it also provides an opportunity for them to learn. So thank you for that.
The next generation of public health professionals we're excited about.
Anything else you'd like to say? Anybody else? Okay, thank
Thank
you. Next is Suzanne Scott, Adult Detention Medical. And you have your report. Is there anything that you'd like to point out or say anything about? Thank you.
We concluded our serial COVID testing, and we're happy to report that we're now COVID-free in the jail. We're still doing random staggered checks, but everybody is getting or trying to get back a little bit to normal.
Okay.
And so that's a good thing.
Anybody have any questions? Nope. Well then, thank you.
Thank you.
Next is Jason Tabb, Juvenile Detention.
Good evening.
We have your report.
You do. I don't have anything to highlight. I'll answer any questions if you have them.
Any questions for Mr. Tabb? Nope. Thank you.
Thank you.
Next, we have Tim Wiley from the nursing home administrator. Okay, you have 2 items for action. The first one is request approval and engagement letter with Templin Healthcare Accounting Services LLP. And is there, I have motion for that, please? Motion by Martin, second by Chung. And if you want to talk about that, and please turn on your microphone. Thank you.
Hello. Just a brief summary. The services that Templin would be able to provide for us will be critical in us doing a lot of improvement in our AR aging and our receivables going forward, our billing processes. He brings a level of expertise that I'm not able to provide. I'm able to understand the system, but he's able to provide steps and brings a great deal of experience. I've worked with him in the past, and will definitely have a tremendous value add and an ROI for us. Just for the sake of time, we're all very pleased with um, the trajectory that the home has been able to establish during the reporting period. I am excited to tell you that there's other good news from a statistical standpoint and a fiscal standpoint outside the reporting period, including that the month of March had an average census that was 95, and April 1st and April 2nd, we hit 100 in our census. The last time we were at that number was September 24th of 2019, not that I checked.
Any questions on his monthly report? Thank you. Okay. And then you have an item for information on LPNs on increasing the starting wage. Was this also at finance? Thank you. Any questions on that or comments? Member Metzger.
Just because it came up in finance and I was pretty surprised at the number that you currently have and the number that you need. If you could share that, I think this committee would be a little surprised at. And it confirms what we need to do here. So the total number of, I think you have 4 LPNs that you have on staff and you need, I want to say need 10 or 20. I can't remember the number. It was quite a lot. It was quite a.
So the number of full-time, the number of LPN FTEs budgeted for the home is 11, and we've employed 4 over the last year or more.
So I guess that told us, not only, it told us finance how critical it is. And then the fact that you haven't, if we can raise this rate and get those individuals in the door, the revenue, that savings was almost, I mean, it was $94,543, which is very significant. So hoping that this will drive forward the plans you have. So thank you.
And I just have a question too, because the Blue Ribbon Panel a couple of years ago did a survey of that. Are all nursing homes in the area, have they really raised their rates that much since we actually had that survey?
That much and more. In the last 2 months, 2 of our competitors have raised their rates even more. I, to that, I feel like we're okay with these rates because their working conditions are not what we're able to provide. And and the word is out there about that, so I think this will just be the missing piece for the recruitment. And just to emphasize, and thank you for bringing this up, that the annual savings of 94,500 is per FTE.
And there was one more question that I had asked our administrator, Ms. Taylor, and that was there a concern on compression? That you are raising this rate and then you would have a lot of people that you would have to consider bringing, a lot of people, well, you have 4. So the concern is not that, I mean, you can handle that. But, if you had a whole 20 people and then you raise the rate, then you've got a lot of analysis to do, and it can sometimes cause concern on the part of those individuals who don't necessarily get that increase. So there is no compression issue. So if anybody was concerned, that's been answered.
Thank you. Anyone else have any questions?
What is the hourly rate for an LPN? Or is it by contract? I mean, it's a flat rate?
Well, there's the wage scale, the county wage scale for the LPN, and I believe step 1 is below $20 an hour.
How many steps are there in each category? Does it go up to 5 or 6, or is it yearly?
It's, so the wage scale is up to step 100.
Okay, thank you.
Any other questions? Okay. We're going to move on to County Administrator. Sorry.
Thank you, Chairman Schaefer. I have nothing to report at tonight's committee meeting. Thank you.
Okay, is there any other business or communication for the committee? Okay, hearing none. We have bills to pay and a transfer that the auditor has approved and reviewed. First is a transfer for the nursing home. I believe it's also in your packet. Can I have a motion for that transfer? Motion by Metzger, second by Martin. Any questions? All in favor? Aye. Any opposed? Okay. Then the nursing home has a prepaid total of $284,139.32. Motion by Metzger, second by Chung. Any questions? All in favor? Aye. Any opposed? Okay. Health Committee, Jail and JDC Medical has a prepaid total of $225,064.05. Motion by Chung, second by Beer. All in favor? Aye. Any opposed? Okay, that's paid. The Developmental Disabilities Board has a prepaid total of $74,950.71. Motion by Metzger, second by Beer. All in favor? Aye. Any opposed? That one's paid. And last is the Board of Health has a prepaid total of $347,509.92. Motion by Bell, second by Beer. All in favor? Aye. Any opposed? Okay, all the bills have been paid. So let's go back to 4D, 1B, Mr. Wiley has a request under section 10843F2B3 of the McLean County Code to authorize nursing home administrator to offer salary above that identified in section 10843F2B2. We got one document you received, and the question is, do we need to go into closed session to discuss this? And if so, I'll need a motion. No, okay. So I need a motion to approve that. Motion by Chung, second by Bell. Any questions that we can do not in closed session? Okay, hearing none. All in favor?
Aye.
Any opposed? And the motion passes. So we are now adjourned. Thank you.